Medical yoga is combination of the modern medical science and the classical hatha yoga postures, which are designed on the basis of a patient's report, his x-rays, MRIs, blood tests, and his clinical examination. So let's say there is a case of lower back pain, and the back pain has come because of driving for long hours. There will be somebody else who has got back pain because of sitting for long hours. There will be somebody who would have got pain because she has delivered a baby, or there might be a case of trauma. So if there are different cases of lower back pain, their MRIs are going to be different. So their treatment has to be different. So medical yoga talks about different individual sequences basis on the medical reports and his clinical examination. So medical yoga is the advanced form of yoga therapy where sequence is designed to every degree of the posture for that individual. Yes, medical yoga can actually cure most of the back pains. Back pain people suffer because of various reasons, and they think they have, people have some misconceptions about it. They think they have got the back pain because they were pushing a heavy object one day, because they got a little jerk on one particular day. That is not the reason of the back pain. That is the manifestation of the back pain. The discs in the lower back, they start dehydrating because of your faulty lifestyle. If I have to show it to you on a model here, these are the two vertebrae of the lower back. Let's say this is L4, this is L5. And then there is a disc in between here. The disc is a jelly-like structure, So this is where you absorb the shock. And this is where you do the movements. Bones don't bend. Disc can actually bend right, left, front and back. And then these yellow structures here, these are the nerves which are coming from the brain going to the legs and different parts of the body. Now let's say there is somebody who sits like this 6 hours a day or maybe 10 hours a day. So what happens is the disc, which is absorbing the pressure, the body weight the whole day, it starts dehydrating. Disc has two components. One is the jelly-like structure and the fibers. Fibers hold the jelly inside. So the jelly starts dehydrating, and the disc does not have external blood supply. So the nutrition of the disc is its only nutrition for the whole life. So the jelly inside, if it starts dehydrating, disc will develop cracks. And these cracks are developed over years of faulty posture. Means you drive scooters for a long time, you sit on computers for long hours without taking breaks, or there are some people who directly, when they think of their fitness, they think of treadmills. They jump onto the treadmill, then they start running on it. It does not have shock absorption system, so the disc starts absorbing the shock. So in all such situations, the discs are dehydrating. They have cracks. Now if the disc has cracks, all you need is a push one day and the jelly comes out. That causes slip disc. Now, can you say that slip disc is because of that one particular jerk? It is a combination, it is the accumulation of the stress, physical stress, that has caused the disc vulnerable to that one particular jerk. So that day is the manifestation of the problem. So that is why we say yoga should become your lifestyle. Stretch your body daily so the disc don't dehydrate. Or let's say if you're sitting for 8 hours a day, at least on weekends you should go and do yoga so that the natural behavior of the body or the natural structures of the body are restored. That is why yoga is better than some other forms of exercise also, where you lengthen the spine and the discs rehydrate. So when we talk about curing the problem, yes, yoga can actually cure most of the problems arising in the lower back. Even if the discs are dehydrating, yoga can actually rehydrate most of the discs. And the nerve, which usually pinches because of the slipping disc or the disc which is bulging or protruding, also adjusts and the pain goes away. Any medicine that you take, be it a pain blocker, be it a calcium supplement, vitamin D supplement, or an anti-inflammatory, or whatever that you take, none of these medicines pushes the bone away. They can't. They can only strengthen the bone. Vitamin D, calcium will strengthen the bone. Anti-inflammatory will reduce the inflammation in that area. They can't push the bones away. And if it is a physical problem where the discs have come closer to each other and bones have come closer to each other and the disc is protruding or bulging, no medicine can treat it unless you stretch the bones away from each other and create space. My Acharya-ji, Dr. S.V. Karandikar, says yoga is a high-tech space science. It's all about spaces in the body. The Akash Tattva of the body has to be readjusted. So restoring the natural behavior of the disc, restoring the natural behavior of the muscles in the lumbar region is the work of yoga. And once the natural functioning is restored, it's called curing of the problem. That is the cure. And yoga can actually cure almost all kind of low back pains. There are different reasons of back pain. When there are different reasons, there are different solutions. How can one solution of Bhujangasana or Sarpasana fit everyone? Not possible. I give you an example. Let's say there is a female who has delivered a child. That means her abdominal tone will be lesser, and the curvature that develops in the pregnancy time, it dips the lower back towards abdomen and pelvis comes back. So the hip goes back and lower back dips forward. Now if you will ask that lady to lie down on her tummy even after 3 months of delivery and ask her to raise her leg like Bhujangasana or the front of the body in Sarpasana or Bhujanga, she is bound to get lower back pain. Her pain will increase for sure. She might get temporary relief for a few hours, but then she has to do her postures again next morning. When we talk about cure, it means you do these postures for 2 days, 5 days, and the pain is permanently gone. So the pain is not permanently gone if you do back bends, especially after delivering a child. Now let's say there is another case where the person is sitting for a long time on computers. This is the normal lumbar curvature, which is a little C-shaped. The muscles here on the back, they get tightened because of long sitting hours, and that is a protective mechanism of the body, because you are sitting for long hours, so body remodels itself. So it pulls the muscles backward, bones backward. So the C-shaped curve becomes straight. Now, if the curvature has become straight, how will it affect your spine is something that is very, very important to see. This is the disc that I've taken out here. Look at the structure of the disc. It is thinner from this side and thicker from this side. But if there is a person who sits for long hours and the curvature is gone, so the bones will be like this. So the gap on the front side and on the back side will be same, which is naturally not same. So the front side of the disc is getting compressed and the jelly is pushed backwards already, which is in the center is now pushed backwards. Now that fellow, if he does forward bends, that jelly might protrude outside. So in his case, you don't need a forward bend. Now, does he need the back bend? No. These are not the only two choices that you have. These things have to be taken care of when you're designing a sequence. So there is no blanket rule that all forward bends are banned. Same way, it does not mean that back bends are going to help you. They might harm also, and they might help also to a very less number of people. So the sequence has to be designed medically for every individual. The reporting which is done in an MRI film is done because there are more, allopathic doctors look into the MRIs. yogic view of the MRI is different. So a radiologist, when he writes the MRI, he is writing it for his allopathic colleague. He's doing his job right. Just he's referring it to his friend or his colleague who is bachelor in medicine, bachelor in surgery, MBBS, bachelor in medicine, bachelor in surgery. So that, or he's an expert or a super expert. His expertise will be either in medicine or in surgery. His super specialty will be either in medicine or in surgery. So when you go to a specialist, he'll give you either medicine or surgery. That is what he's trained for, right? So he writes down the prescription of medicines. And you go back to him again and say, "No, sir, pain is still persisting. It's not going away." He says, "Okay, medicines are not working. Surgery is the last option for you." When he says surgery is the last option, it is because of his education. It is not that is the last solution on earth. No. That is his education. That is what he has been trained for. And he says surgery. And then the patient goes to another doctor. He is also super specialist, either in medicine or in surgery. And ultimately, that doctor also advises the same thing, because every doctor refers to the same book, the same protocol. And then the patient goes to a third doctor. And then they say, "We have visited Asia's best doctor, India's best doctor, or probably the best of the best doctors. And all are advising surgery. How can you in yoga or medical yoga, how can you save our surgery?" We tell them that is not God's word. They are trained for medicine and surgery. They are doing their job right. But that is the last solution according to them, not according to medical yoga. There are solutions. And we have been treating such patients day in, day out. There are patients who are coming to our center from last 15 years or more now. They were advised surgery by the specialists. Multiple times they were advised for surgery before they came in. Now it's been 15 years. They come from out of Delhi. They have their session for a day or two and they go back, they practice. Like everybody practices yoga, they practice their medical yoga sequence. And they are running fine. They're doing it well. And they are 65, 70 years old. So surgeries can be saved. You must practice yoga regularly. Regularly does not mean daily. Regularly means if you are doing it from last 10 years and do it twice in a week, we'll say you are doing it regularly from last 10 years. Surgery should be the remotest possibility, should be the remotest thing to think of. So surgeries can be saved, very effectively saved, and not just for a month or two, can be saved for life. Yes, it is. What is sciatica? There are 6 forms of sciatica. Out of, if I categorize them, piriformis syndrome is one of the most painful forms of sciatica and one of the easiest form of sciatica to be treated. It takes 15 minutes to treat piriformis syndrome here in the center. What is piriformis syndrome? There is a muscle, piriformis, that is here, where my fingers are. The nerve, the sciatic nerve, crosses between the piriformis and the gemellus superior muscle, and it goes like this. So, you have to draw, it is like this, between the two muscles. You were sitting in a meditation posture, or you were sitting cross legs for a long time, or you drive your car in a faulty posture, and you keep your foot rotated outwards. These muscles get tight and they hold the sciatic nerve between them. There is no slip disc, but the nerve is getting pinched under the pressure of these two muscles. So what you have to do is stretch these muscles and the pain goes away. So the results are visible from the day one. But muscles at times, they repeat their, they become habitual because people drive in a faulty posture daily. So the muscle gets tightened again. So you have to practice yoga regularly for a couple of weeks so it becomes your natural behavior and the pain doesn't come back. Maintain a healthy posture, number one. Do yoga regularly, number 2. And one thing that you can very easily do without going to a yoga class, by wearing cushioned insole shoes. You will see in last 25-30 years, or maybe in 50 years, all the surface under the foot has become hard. Earlier there used to be verandas, there used to be some uneven surface, you used to walk on grass, on mud, on the roadsides. Now from corner to corner the roads are metalled, they are all concrete roads. Even when you go to the park, there are tiles in the park. In your houses there are marbles. And your footwear at times, not at times, in most of the times, it is hard. So your foot, which is designed to adjust on uneven surfaces, there are 26 bones in one foot, 52 in your 2 feet. So the bones are designed, your foot is designed in a way that it adjusts on uneven surfaces. The shock is absorbed by the grass, the mud, the cinder that you walk on naturally. And that has changed drastically in the last 25-30 years. And that is why the knee replacement cases are also increased. Because every time when you put your foot down on the floor, there is an equal and opposite reaction, Newton's third law. So that shock is absorbed by the knee cartilage and the lumbar discs. So when the disc is absorbing the shock in the lumbar region, it is getting further dehydrated because you don't stretch. You sit for long hours. You stay in a faulty posture, you drive for long hours. So all these things are anyways causing pressure on the back. So reduce that pressure at least by walking on a cushioned surface. Same applies to the knee cartilage, the meniscus in the knee joint. It absorbs shock every time when you walk. So the pressure on the disc and the meniscus will reduce significantly if you use a cushioned insole footwear.